Welcome to the Parkland Report. I'm Stephanie Stewart, Vice President for Strategic Partnerships and Workforce Innovation here at Parkland College, and your host for the show that talks to the people making things happen here at Parkland College. Today, we have three guests from Parkland's Health Professions programs, and so we'll be learning about dental hygiene, veterinary technology, as well as respiratory care. But our first guest is Laura Hedinger. She is our Program Director for Dental Hygiene. Welcome to the show.
Thank you for having me.
So talk to us a little bit about the dental hygiene program at Parkland, who your students are, and what their career aspirations are.
So Parkland has a 2-year dental hygiene program, but we like to call it actually a 3-year because it's about 72 credit hours. So there's a lot of non-dental hygiene courses, biologies that are really great to take before you actually get accepted into the program. Once you're in the program, you'll start in the fall. It's a cohort. We take 36 students. Those 36 students move through the cohort together. So you'll be in 5 semesters. You have a fall, spring, 1 summer, and then fall and spring, and then you graduate.
Very exciting. And you work with dentists in the area, and there's a critical need for dental hygienists. So can you talk about those career prospects they might have?
Right now it's very booming, right? Due to COVID and everything that's happened in the past 4 or 5 years, there has been a decline in dental practitioners, hygiene especially. And so there is a large demand. We have, I would say, 100% placement for anyone who wants to work after they graduate. We have demand in the area, Champaign, Bloomington, surrounding towns, Chicago. It's a great profession if you like to help people. And again, you'll have a really good prospect of a career placement afterwards.
And you talked about helping people, and I know I've heard you speak in the past just about how important your teeth are to your overall health and wellness. Can you share a little bit with our viewers who, I think that there are some kind of fun facts in there that I didn't really realize that impacts other body systems.
I think people think that their oral health is a separate entity, but it actually is all connected to our body. So whatever inflammation you have in your oral cavity, you're going to find it somewhere else in your body. Research has shown that there is connection between disease in your mouth and disease in your heart. There's connection between disease in your mouth and diabetes. It's a bidirectional relationship. So if you're not taking care of your sugar level in your bloodstream, it's also going to reflect in your mouth. And if you're not taking care of your mouth, you're going to reflect that in your bloodstream. So there's lots of connections. When people come into our clinic, they always, we have this detailed medical history, and they're asking, like, why do you need to know all this? But really, what we do is more than just cleaning teeth, but we're actually preventative specialists. So we're helping to keep your mouth healthy and your overall health healthy as well.
That's so important to think about, and really there's a large gap in the community as well of individuals who perhaps don't have access to dental care, and our clinic where our students are getting that practical experience sort of fills that gap. Can you share about how Parkland's program actually serves the community and helps to fill that gap?
Yes, we are a community clinic, basically. We have our clinic open to the community. You can call Parkland Dental Hygiene Clinic and make an appointment. We need community members to come in because your volunteering of your time helps to serve our students, right? But also our students are able to serve populations who may not have access to dental care. So maybe you're uninsured or underinsured, or you need an extra cleaning that your insurance doesn't cover. We are happy to fill that gap. So we can see anyone from the age of 4 all the way up to, there's no limit to that. And we're happy to take appointments at any time. We take appointments year round.
That's great. How many individuals from the community do you all serve in an average year? It's hundreds, right?
Yes.
It's a lot.
It is. I want to say we have like 500 phone calls in a month or something crazy like that. It is. We have a very high volume of patients. That's a good question.
Yeah.
Yeah.
Well, one of the events that you all had fairly recently is an event for children. So can you share that with our viewers? I think it's a very impactful, the work that you all do as part of this special event.
So we like to do collaborations with the community, and one of those collaborations that we do every year is Give Kids a Smile. We work with the Illini Dental Society with CUPHD, and we are able to serve children, anyone 18 or under. And last February, which was a couple months ago, last February, we actually saw 180 kids between the hours of 8 and noon. We ended up extending it a little. I think we ended up getting out of there at 2 o'clock because we had so many kids that came up that needed to be seen. So yeah, it's amazing. We had, I want to say, 14 dentists from the community that came, volunteered their time, did the exams. We had all of our first-year students and all of our second-year students. Our second-year students were doing the cleanings, the prophylaxis. They were doing fluoride. The dentists were doing the exams. And our first-year students were doing all of the education. So they went through an education room where they got to learn about how to take care of their teeth. They got a new toothbrush, toothpaste, kind of set them on their way for prevention.
That's great. Yeah, I know that those visits to the dentist are part of kindergarten registration and at various points to participate in K-12, but there really is an expense. So to help fill that gap and make the connection is incredible. Something else that I've heard over the years is how far people will travel to come to our dental clinic. Where do people come from to come and be patients of our Parkland students?
All around. So we may have people that drive a few hours away. We had one patient particularly that's coming from Chicago. So they would see a school in Chicago and then see us on the alternative, so because they could only be seen so many times at that school. We have, it doesn't matter where you live, you just need to make an appointment and we will see you.
That's great. And I think for our viewers too, we talked about just the great career prospects. There's a lot of opportunity to get that job, but could you speak a little bit about the profession and why it's so important to you to kind of give back to our students and to develop this next generation of Parkland dental hygienists?
Well, I'm a graduate of Parkland dental hygiene program, actually, so I am Parkland proud. I really enjoyed the program while I was here, and it made such an impact on me that I wanted to give that same impact to students who might be coming into Parkland. It is such a profession, it's been such a good profession, it's rewarded me in so many different ways. If you really are a people person who like to make a difference in someone else's life, dental hygiene is really the career path for you. You get to help people in all sorts of different ways. It's not just about cleaning their teeth. You might see some sort of oral systemic link in their mouth, and you might be that connection that's going to help them to get that solved, right? You may see something that's precancerous, and you're going to be referring that patient out. I had a patient who had a strange, lesion on their tongue, ended up being cancer, precancer. They were able to get that off and take care of, it was life-changing. Stop smoking after that point, right? There's so many behavioral things that we can help in patients' lives and different ways we can impact patients' lives.
Yeah, that's really incredible. So if someone who's watching or their family member is interested in learning more about the program, how do they get in touch with you all?
If they want to make an appointment with the clinic, they can call our clinic number. It's 217-351-2221. And if they're interested in the program, reach out to me, lhedinger@parkland.edu.
All right. Well, Laura, thank you so much for being on the show today. We
Thank you.
appreciate it. All right, we'll go ahead and take a break. And when we come back, we'll learn more about Parkland's Vet Tech program.
My junior year of high school, my dog Sadie got sick. She got liver and kidney disease. So seeing her and growing up with her, it was kind of hard for me to watch her kind of slowly go, but it made me want to help her and other dogs later on in the future.
I have always wanted to work with animals, but I didn't ever want to go to vet school. But this job, I get to work with the animals and the people side as well.
I chose the vet tech program because I had always wanted to work with animals, but after I looked into vet school, I decided that wasn't for me. And as soon as someone told me what the Parkland vet tech program was about, I was like, yes, that's exactly what I want to do.
Part of this program that surprised me the most was all the aspects of study that go into pursuing a career as a veterinary technician.
The workload, how much different it was from just high school or just another junior college. It was just a lot more classes and a lot more time consuming.
I was not expecting to go right into applying our classroom knowledge to physically doing stuff, so getting to work with the animals right away was really cool.
Working with the animals, I'd say it's really fun. It's a good learning experience being hands-on. Watching their attitude completely change, being from scared to comfortable, getting to know them personally. It's a really good feeling to know that you actually kind of make a connection throughout the whole year with them.
So you have to be well organized, you have to be able to communicate well with your team members, and you have to be able to multitask really well.
I've had to learn to manage my time. I've had to learn how to study, because in high school I really didn't study like I had to.
I would say having study groups and your friends for support is definitely a big thing that helped me get through this program. The most rewarding part of being a veterinary technician is to be an integral part of caring for animals, and the rewards of being a veterinary technician to help maintain or improve the health of an animal are immeasurable.
It's nice because you can see the animals that come in that have problems or issues, and then seeing the end result. So seeing and helping them get better.
Watching them grow, from a little puppy to a full-grown adult, and then watching how happy the clients are when you have to make the patient better and help them out.
My first experience working in the veterinary field during my internship was gratifying. My internship allowed me to encompass the veterinary field as a whole, and I was able to gain experience with all aspects in the clinic setting.
It went really well. My first few days there, they just let me jump in, do hands-on things. It was really nice to actually go from Parkland and then to an internship where you actually apply your information.
All the other techs at the clinic also had graduated from Parkland, so they kind of knew where I was at, but as soon as I got in there, everything I had learned at Parkland applied to the clinic I was working at.
Dr. Ellard and Amber and Lori and Sarah and Mary definitely taught us the golden standard of everything. I felt prepared and ready to be in the vet tech career.
Welcome back to the Parkland Report. For this next conversation, we're going to be talking about Parkland's Vet Tech program. So if you like cats and dogs and animals, this is the program for you. And welcome to the show, Dr. Laura Suter.
Thank you.
Who is our program director for Vet Tech. So tell our audience about your program and your students and what they need to know.
Yeah, so we are a 2-year program. It is an associate's degree, and then at the end they sit for a board exam, and as long as they pass their board exam, they become a certified veterinary technician.
That's so exciting. And we were talking before this segment started just about all of the different experiences that your students have with different kinds of animals. So can you maybe provide a little bit of an overview of what those are like hands-on and then also in the classroom?
Yeah, so here at Parkland, we actually get teaching animals from our local animal shelter. The animals live on campus for 1 school year. The students take care of them, they train them, they teach them tricks sometimes. And we do all of their health care, get them all healthy, and then we find them homes. So those are cats and dogs. They also get to work with large animals, so cows, horses, sheep. We utilize the U of I's farms over there. We don't have cows running around Parkland, but yeah, they get a pretty wide range of experience. They also do clinicals at the U of I vet school and sometimes get to see an occasional camel or a parrot or something kind of unique over there.
That's great. It sounds like a great program for animal lovers and folks that want to go into that. I was marveling at a cute puppy named Colby who's on the Health Professions Facebook page. So that's definitely a place to check that out. But can you share a little bit about the adoptable animals that might come available at the end of the semester?
Yeah, so all of our cats currently have adopters lined up. We do still have 3 dogs that we're looking for homes. We generally always let our students get kind of first pick at adopting, and then if there's any animals that still need homes around April, we'll post them on Facebook and try to find those animals homes. We have a 100% success rate of adoptions, so we do find homes for all of our animals, and yeah, so keep an eye out if you're in the market.
That's great. One of the exciting parts is that you can take that love for animals and actually turn it into your career. So what are the different career pathways that are available to students that go through your program?
Yeah, absolutely. So the traditional pathway is working at a traditional vet clinic as a vet tech, but we've had students work in research facilities. We've had students go on and work in large animal capacities as a vet tech. We've had students, a lot of our students actually end up working at the teaching hospital at the U of I. With that partnership that we have with our clinical experience, they kind of get to see what a job there might be like. So yeah, there's a huge market for vet techs right now. There is a shortage, so all of our students, pretty much if they want to find a job after graduation, they can find a job.
That's great. And you mentioned partnership with U of I, not just at the vet med school and the clinic available, but on the academic side of things. So can you share a little bit about what that connection looks like?
Yeah, so we recently started a partnership with the Animal Science undergraduate program at U of I. And the current partnership allows students who are in the animal science bachelor's degree to actually apply for our program and finish their bachelor's degree while also getting their CVT certification. So they're essentially finishing up their bachelor's degree and then going through our vet tech program at the same time. We saw a need for it. Every year we were having multiple students who had already graduated with that bachelor's degree and then would apply for our program. And we're like, why don't we just kind of combine those last few years? And now at the end, they have both of these options.
That's great, getting the hands-on as well as that the science background to work with those animals. Just working with such a wide variety of animals. We were talking about maybe some of the most exotic or interesting animals that you've worked with, or maybe what your favorite animal is. So in your career so far, what has been your most favorite experience or favorite animal you wish you could work with?
Yeah, so I actually started out primarily working with cows, believe it or not.
Okay.
So I'll always have a special place in my heart for working with cows, but I really just love working with cats and dogs. I pretty much love every animal though. I've worked on pigs. I've done a little bit of work with some kind of rare animals. I did help a certain species of buffalo one time. That was pretty cool.
Oh, wow.
So yeah.
Neat. And I think being in the room, just as a pet owner myself, right? You're in the room, and those vet techs are really hands-on with the animals. So how do you prepare students to be in there, because you've got two patients, right? You've got the animal in front of you and potentially their owner who's there. And how do you prepare a student to kind of walk into that environment and be able to do the work that they need to do to help with the health of that animal?
Yeah, yes. So there is the animal and there's also the owner attached to that animal. So we do a lot of, learning the actual skills, but it's a lot of communication as well. You have to be able to tell that owner what you're doing and why you're doing it. So we do include some aspects of communication and also just getting so proficient at those skills that you can perform them in any environment with anybody watching you. Because you're generally going to have people watching you, and so you just need to have that confidence to be assured in yourself and your skills, and then you can do them.
Yeah. No, that's work under pressure, that's for sure, especially if an animal is upset or stressed by being there. But I think the other element, our other health professions are all about the human body, but these are the animal bodies. So what are the correlations, I think, between some of the sciences and maybe anatomy and the things that we do for humans, and how does that translate to the vet tech program and the science behind it?
Yeah, that's a good question. So general anatomy is fairly similar, but then there's a lot of different species differences. So throughout our program, we go through general anatomy, and then we kind of break it down by species. So cats, dogs, cows, horses, and how all of those are kind of similar, but then kind of different. So it's definitely a lot of different kind of pieces that have to fit together. It's not just, one species we're working on. So it's, a lot of anatomy, a lot of learning about the different species.
Great. So if someone wants to learn more about the program and see if it might be a good fit for them, how should they reach out, or what's the best way to learn more about your program?
Yeah, so probably the best place to start would be on the Parkland website. You can look up the vet tech program there under veterinary technology. My email address is on there. You're welcome. People are welcome to email me, and I can answer any questions. I love giving tours to prospective students. Taking them around. They can meet with health profession advisors as well to kind of go over the different courses. We don't necessarily require gen ed courses to get into our program, but we do require them to be completed by the end of our program. Okay. So we can accept applicants right out of high school, but we can also accept applicants who have some or all of their gen eds, or some of our applicants already have a bachelor's degree or a master's degree. So it's really a good program for anyone who's interested in becoming a vet tech or who wants to work with animals.
That's wonderful. Well, Dr. Suter, thank you very much for being on the show today. It's always fascinating to to see what you guys are up to in vet tech, and we'll have you back on the show, and maybe we'll have a new crop of animals that might need homes next year.
Thank you.
All right. Well, that's it for our conversation on vet tech with Dr. Suter. And finally, we'll be back in our next segment to learn about respiratory therapy.
With Midge Same, and we're going to talk about respiratory therapy. Okay, kind of tell me what respiratory therapy is, if someone doesn't know.
A respiratory therapist is a specialty healthcare provider. We take care of patients who, for whatever reason, are having difficulty breathing. Sometimes it's an acute illness, an acute injury, like a gunshot wound or a knifing or an automobile accident. It could be an illness like a pneumonia that causes somebody to have difficulty breathing. It might be somebody who has chronic lung disease, emphysema, chronic bronchitis, asthma.
Okay, now, are these people, once they graduate, are they working out of a hospital mostly?
About 85% of the therapists today will work in a hospital. Other opportunities for a respiratory therapist are in home health for those patients who have chronic illness. So sometimes respiratory therapists are recruited to do medical sales. It's easier to sell respiratory equipment to a respiratory therapist if you have some understanding.
So then 5 semesters and they're done with the program and ready to work.
2 years, 5 semesters. We start in the fall, go straight through until 5 semesters later, graduate in May. We tell our students to consider their clinical rotations the longest performance-based interview they will ever have, and most of them will graduate with job offers.
Welcome back to the Parkland Report. For our third and final segment on Parkland Health Professions today, we're going to learn about respiratory therapy. So welcome to the show, Molly Martin, who is the program director for our respiratory care program.
Hi, thanks for having me today.
We were talking before the break just about what does a respiratory therapist do and how do they support patients?
All right, well, respiratory therapist is a lung specialist, and we promote lung health. So there's a lot of patients that have either a chronic lung disease where it affects them every day, but they also may have an acute disease or acute illness or an injury that has to be taken care of. So we see those patients from both of those realms, and sometimes they actually have an acute episode upon the chronic episode. So we do a lot of therapies that are going to help promote oxygenation and ventilation, essentially the gas exchange that we use to breathe every moment of every day.
Yeah, breathing is so essential, obviously, and just how essential respiratory therapists are to our overall health. And if we were to have an emergency, how critical it is that there are individuals with that expertise there. So can you talk about the program and what our students learn as part of the respiratory therapy program?
Okay, so coming into the program, it's a 2-year program, 5 semesters, 5 quick semesters, and 71 credit hours. Students will come in and learn foundational knowledge about the field of respiratory care that they can build upon throughout their program, and then we blend in clinical care as well. So students not only attend class, but they also attend clinical, and they really get that hands-on experience from being in that clinical setting.
Talk about what the clinical experience is like for a student. So where do they go and who are they working under? Are they just put into the room, or what type of guidance is provided for them as they're learning?
Okay, we have about 8 different areas, different hospitals that our students visit and do clinical time in throughout their program. Most students usually see 4 to 5 different hospitals, so it really gives a good view of the different hospitals that they may work in the future. When they get to clinical, they usually have a preceptor that is with them throughout the clinical day and that guides them. So we really use that preceptor model. And throughout our clinical sites, we have those primary preceptors that really want to precept students and to promote that learning. So our students end up with about 750 hours of clinical experience by the time that they leave the program, and that's everything. As respiratory therapists, we go to all different care areas. So we may see every patient population, adults, adolescents, children, infants, neonates. And we will go to many different areas within the hospital, including like the emergency room, all the ICUs, whether they be adult or pediatric or neonatal. And then we have the whole host of patients on the floors that have had surgeries, medical illnesses along the way. So they get exposed to all of those patients and the kind of the dynamic changes that happen with somebody's breathing.
One question I had for you that I was wondering is just how does a respiratory therapist work with all of the other roles and responsibilities? You see folks come into the room and they have different color scrubs, and you're wondering how are they all working together? So can you share for our viewers just how you work as part of that overall team?
Yeah, so as the interdisciplinary care team, we all take care of the patient, and the respiratory therapist is part of that team. So at the bedside, you're really going to see the nurse that's primarily taking care of that patient. We'll also have the doctor at the bedside, visiting throughout the day as the patient needs. And then, of course, we rely on our healthcare techs a lot as well, and then the respiratory therapist is at that bedside taking care of all the respiratory needs of the patient.
That's great. And you had mentioned just the clinical placements, but there are so many career opportunities in this area. So can you speak to the need and then also maybe some of the different career options that there are for students going through your program?
Okay, like a lot of other health professions at this point in time, we are really in need of more respiratory therapists. And when there's actually a nationwide push for that through our professional bodies. And really just thinking about the aging population and how much, they are going to need respiratory therapists. So if you have a heart problem, if you have a kidney problem, you're probably going to have a lung problem as well. So a lot of those other organ systems cause lung problems. Mm-hmm. And so we're going to see our need more and more throughout the years. And right now, it looks like respiratories, they're predicting about a 13% growth.
Oh, wow.
There's around 133,000 jobs out there for the taking, and so I can see our need increasing over the course of time.
That's great, and it's not just in the hospital, right? There are other different paths.
Okay, yeah. So most therapists work in the hospital, but there are different areas like pulmonary rehab, pulmonary diagnostics. Some of our therapists work in doctors' offices doing education. You might even, want to head somewhere, out west maybe, and do transport either by ground or by air. So a lot of different little caveats. Respiratory therapists can go into research.
Oh, wow.
So that's a big area. And also our industry. So, in sales essentially. Mm-hmm. So of respiratory care products. So.
Yeah. So most of our viewers or loved ones have probably interacted with a respiratory therapist. I was sharing a story about my son during the break. When he was little, he had RSV, which is a common occurrence for families. Right. But sure enough, that respiratory therapist was right there. I'm sure a comfort to lots of families in those scenarios.
We really like to make sure that our patients are breathing well. We're pretty good detectives. So if we start, assessing our patients, we can, turn that situation around, hopefully, and maybe not get them admitted. Maybe they only go to the emergency room and then they're back out the door. So things that we can do to help move on that illness and get them back to functioning in everyday life.
That's great. So if this is sounding interesting for a student, what are they in for in terms of, you talked about the credit hours, but what does that coursework look like along that journey to becoming that professional at the bedside working with those patients?
All right, so 5 semesters, it's really broken down. Start off with those basic skills to begin with. So first semester's foundational knowledge. You can expect to have courses in disease processes, medications that we give, respiratory sciences, so some of the theory behind breathing, essentially. And then in our second semester, our students start going to clinical. So that's always an exciting time. After the first semester's foundational, and then the second semester is when they get into clinical practice, and then take even more classes that learns about like arterial blood gases and starting to get into critical care at that point in time too. So our students have the opportunity throughout their program to, they will definitely have a basic life support certificate, mm-hmm. and they have the chance to earn a pediatric advanced life support credential or certificate, I should say, and also an adult critical care advanced life support.
That's great.
Certificate as well. So they're pretty prepared by the time that they roll out the door to take that exam, that board exam, and get credentialed at the RRT level, and then get licensed after that and go into clinical practice. So it's 5 semesters. It probably seems like a long time, but it really goes rather fast, and it's really exciting with that clinical component in there too, because you're bringing that foundational knowledge that you have from the classroom and taking it to the bedside.
That's wonderful. So if someone's interested in learning more, what's the best way to find out more about your program or reach out?
Okay, you can Google Parkland and go under academics. Under health professions, you will find you can get into each one of the different health professions, pick respiratory care, and our information's right there on that page so you can get a hold of us.
Well, thank you so much for being on the show today. It's fascinating to learn about your field and what our students are learning. So
Thank you very much.
All right, well, that's it for today's episode of the Parkland Report. Thank you for learning about Parkland health professions on today's episode, and we look forward to seeing you next time.